I'm Nirav Shah, the director of the Maine Center for Disease Control and Prevention. I'm joined this afternoon by Governor Mills and Commissioner Jean Lambrew from Maine's Department of Health and Human Services. Governor Mills, Commissioner Lambrew, and I, pleased to be with you today to discuss where we are with respect to COVID-19 for today, December 8th, 2021. I'll begin by providing a short epidemiological and public health update before turning things over to Governor Mills. We begin today's discussion and update on yet another sad set of notes. The Maine CDC is reporting 8 additional COVID-related deaths today, including 1 resident of Androscoggin County, 1 resident of Hancock County, 4 residents of Kennebec County, 1 resident of Somerset County, and 1 resident of Washington County. 2 were women and 6 were men. 2 were in their 50s, 2 were in their 60s, and 4 in their 80s. Across the state, as of this morning, there have been 125,373 cases of COVID-19, representing an increase of 1,275 new cases since yesterday. One note on those case numbers for today. The unprecedented number of positive test results coming into the Maine CDC every day affects our ability to process those tests on a daily basis. Simply put, there are now more positive test results coming in than we can process in a single day. We're taking steps to address this unprecedented volume of test results that we receive. We're redeploying current Maine CDC staff. We're continuing to hire and train new staff as well. We trained a new group of staff 3 weeks ago, another this week, and another group next week. But the bottom line here is that we are past the point where the change in the number of cases from one day to the next is the principal indicator of the severity of the COVID-19 pandemic in Maine. The pandemic is at its peak, and we expect the number of reported cases in each day's update to stay at current levels and likely increase in coming days as we bring on more staff. Turning next to testing. The 7-day PCR positivity rate across the state now stands at 10.8%. And the PCR testing volume today stands at 763 such tests that are being done for every 100,000 people. This is near the peak of all of the testing that has been done on a daily basis throughout the pandemic. That number, 763 per 100,000, is about the highest we've seen at any point throughout the testing during the entire pandemic. It's a good sign, and it gives us more confidence that we're seeing all the cases that are occurring across the state. In terms of vaccines and vaccinations, right now in Maine, out of every single person in the state, 73% are fully vaccinated, and 83% of everyone in the state has received at least 1 dose of vaccine. Among those who are eligible, that is to say those who are 18 and over, 34% have received a booster shot. And across the state, we are right now administering 9,377 doses of vaccine every single day. That's a 67% increase in vaccination rates compared with just 1 week ago. I want to close today by talking about where we stand on hospitalizations before turning things over to Governor Mills. Right now in Maine, there are 379 people who are hospitalized with COVID-19, another sad high point. Of those 379, 117 are in critical care units. Again, also another sad high mark. 60 individuals are on a ventilator, which is tied for the high mark that we set on Monday. And of those 379, 7 children are currently hospitalized across the state with COVID-19, and 3 of those 7 children are in a pediatric intensive care unit bed. To discuss this issue more, I'd like to now turn things over to Governor Mills.
Thank you, Dr. Shah. 379 Maine people today hospitalized with COVID-19, 7 children. 117 people in critical care, 60 of them on ventilators where a machine pumps air into their lungs, their weakened lungs, trying to keep them alive. These aren't just statistics. They're not merely numbers on a page. These are fathers and mothers and children, sons and daughters, grandparents, neighbors, and friends. They're fighting for their lives in the critical care wards of our best healthcare facilities all across the state. They're truck drivers, janitors, teachers, students, sales clerks, administrators, construction workers, while others across the state are waiting for healthcare procedures so they might live without pain, so they might achieve mobility, so they might find a tumor is benign, so they can get back to work, so they can enjoy regular family and daily life activities, and they're being denied access to healthcare. Most people in hospitals right now with COVID in Maine are not fully vaccinated. Many of them are from the rural areas of the state where vaccination rates are the lowest. You know, this time of year, Maine people everywhere should be celebrating the holidays, should be at home with their loved ones or shopping for gifts for children and grandchildren. Instead, too many of our citizens are fighting for their lives. As a result, also, our hospitals are being stretched thin. Healthcare is jeopardized for those who need it, and our healthcare workers, heroic as they are more exhausted than ever before. We're at a tipping point, and that's why today I'm activating additional members of the National Guard under state orders. In consultation with our healthcare systems, I'm deploying these National Guard members across the state of Maine to expand our hospital's capacity to treat people with COVID-19 and other serious conditions. So beginning next week, running through the end of January, we're deploying as many as 75 National Guard members in basically non-clinical support roles, so like patient transport, food services, et cetera. We're deploying them to healthcare sites such as some nursing facilities, so those facilities can then accept patients who are waiting to be discharged from hospitals where there's just no place for them to go right now. Enhancing those facilities' ability to accept more patients will relieve the bottleneck that will then allow hospitals to provide more inpatient care for more people with COVID-19 and other serious health problems. You know, like the grandparent who may have fallen and injured their hip, or a child who's had a severe asthma attack, or a spouse who's had a heart attack. I'm also deploying National Guard members to administer monoclonal antibodies, a treatment that can help keep Maine people out of the hospital and out of critical care if administered in timely fashion, and preserve ICU capacity for everyone who needs it. What's sad is that we're having to do this during a usually joyful time of year. You know, it's December, it's the time of hope, a season of hope and joy. But while we're celebrating holidays across our state, so many are not so lucky. Hundreds, again, fighting for their lives right here. More than 100 people have died just in the last 60 days, taken down by this deadly COVID virus, especially the virulent Delta variant. And most of them simply didn't take the simple step of getting vaccinated against that disease that took their lives. Well, in addition to activating more members of the Guard, I've also requested federal COVID-19 surge response teams on behalf of Maine Medical Center in Portland and Central Maine Medical Center in Lewiston. Under the Biden administration's COVID-19 winter response plan, if approved, teams of federal clinicians, including physicians, nurses, and certified nursing assistants, hopefully will be there to supplement existing staff and the members of the National Guard to provide care for those who with COVID-19. Taken all together, these actions, we hope, will alleviate the strain on our healthcare system and provide better care to those who are ill. But we're not taking a thing for granted, especially with the imminent arrival anytime of the Omicron variant, against which current vaccines appear to be effective. All the more reason to get vaccinated now. These steps we're taking today are, in addition to the ones we've already taken, including providing some additional flexibility to hospitals to move patients, enlisting the Maine Response Emergency Health Volunteer System to mobilize retired healthcare providers and support current healthcare workers, and providing $60 million in Medicaid temporary rate increases last year, $40 million in one-time payments to hospitals and nursing homes and behavioral health providers in this past summer, and $146 million in the biennial budget in one-time COVID-19 supplemental payments. But I don't take these actions lightly. Money alone is not the issue here. I hope the seriousness of these steps, however, will be a wake-up call about the importance of getting vaccinated, whether it's your first shot or your third. Next week, members of the Maine National Guard will be leaving their families and their communities to join our heroic healthcare workers in stepping up to meet the challenge of COVID-19. Maine people must all step up to this challenge too. Get vaccinated, please. Whether you're vaccinated or not, wear a mask in indoor public settings and crowded outdoor settings. Do what the US CDC recommends. If you run a store or business, make sure your staff are wearing masks too to protect the public and yourselves and themselves. Get vaccinated. Do it for your health, for the health of an elderly relative, for the health of a small child who may be fighting for their life right now in one of our hospitals. Do it for our healthcare workers who bear the greatest burden of all. Do it for our National Guard who are joining them now. Why take a chance? Getting vaccinated to me seems like no different than putting on a scarf in cold weather, wearing a hard hat when you go into a construction zone, or wearing safety goggles if you're welding, for instance. It's just common sense. This holiday season is a gift-giving season. This holiday season gives the gift of health. Get vaccinated today. The life you save may be your own, or it may be one of those small children fighting for their lives in our hospitals today. Thank you.
Thank you very much, Governor Mills. We'll turn now to our colleagues in the media for questions. We've got 14 folks on the list today, so I want to make sure that we give everyone time. The first question for the afternoon goes to Patrick Whittle.
Thank you very much. Are there any more details available about what the National Guard's role is going to be and what sort of role folks can sort of expect it to play in their daily lives? Is there anything else to be said about that?
I think I can start by saying we're working with the Guard leadership, determining who's available for what, who can do what kinds of chores and work. The Guard have been always very trusting and trustful and faithful in exercising whatever duties it takes to alleviate any kind of critical situation. And we expect that, first of all, these won't be medical people. We're not going to take medical professionals out of a healthcare setting, just put them in another healthcare setting. We're hoping that they will do two major things. Provide support to hospitals and nursing facilities with swing bed type beds, those who accept discharged patients discharged from hospitals who are still experiencing critical care capacity challenges. Those are like decompression sites. And there are a number of things that the members of the Guard can do in those sites to help relieve the burden on healthcare workers and, again, in turn, relieve the bottleneck at the hospitals. Secondly, we're expecting that they'll be able to help administer and monitor the administration of monoclonal antibody treatments. There are 3 different kinds of those treatments. That keeps people out of the hospital in the first place if administered in timely fashion. As soon as somebody gets a positive test, they should talk to somebody if they're eligible to get that monoclonal antibody treatment. And that prevents the person from becoming more seriously ill from COVID-19, keeping them out of critical care and preserving our ICU capacity. So those 2 major things are what we envision this deployment to do.
Okay, terrific. And earlier today, Maine Health had a press event where they were sort of talking about the various challenges that the state health system is burdened with right now. They mentioned that sort of the median age of folks they're seeing in ICUs and in hospitals is sort of going downward. Is there anyone who can speak to whether or not that's sort of what the statewide trend is at hospitals?
Yep. Patrick, I can touch on it briefly. And we'll see if we can get more complete data or the full data set on it. But yes, the median age has been falling across all Maine hospitals. And that is largely a function of who has not been vaccinated. Indeed, what we find when we look at who is vaccinated in any given week, roughly 60 to 70% of those are not vaccinated individuals, not fully vaccinated. And that tends to be a younger demographic than what we saw a year and a half ago before the era of vaccines, when those who were hospitalized tended to be on the older side. Even taking a look at just Northern Lights numbers as well, what we see there is right now 80% of the people across Northern Light facilities, 79% to be specific, are not fully vaccinated. And that again tends to be correlated with younger crowds.
It's good to know. Thank you very much.
Thanks, Patrick. Kevin Miller, over to you.
Great. Thank you very much. And thanks, Governor Mills, for kind of giving some additional examples of the support. Sounds like the National Guard troops will be in support roles. But you also mentioned that you were requesting some federal assistance, kind of this medical surge assistance. How quickly, realistically, could we expect, if we got approval, how quickly, realistically, could we expect that assistance to come to hospitals? And then related to that, how likely is it that we might actually see something given the fact that this surge is happening around the country right now?
I think I'll begin by saying that we welcome President Biden's announcement of his winter COVID-19 surge response plan that included a list of 20 plus teams of medical support from FEMA, as well as additional teams from the Department of Defense. We have 2 applications that are in from different hospitals in Maine. We expect to support other hospitals as needed. We've already had some intense discussions with our federal officials, and we've impressed upon them the urgency. Just as a reminder, our ideal way to expand our critical care capacity is to have more critical care providers, physicians, critical care nurses, and that type of personnel. But the ones who are here in Maine are doing that work already. We really do need clinicians from out of state to really supplement that. All that said, we think that our plan, working with the National Guard, to be able to move patients awaiting placement out to, again, free up some of the clinical capacity in critical care will make a difference as well.
Great. And as Patrick mentioned, hospital officials were sounding the alarm today about, some saying that their hospital systems are kind of on the brink because of what they're seeing. Given what Dr. Shah just said about the possibility of seeing increasing cases here in the coming days and weeks, I guess my question is kind of what are the tools are left in our proverbial toolbox? And maybe to Governor Mills, I know you're asked about this all the time about return to restrictions. Is that even an option at this point, or is that something that you're talking about?
Let me begin by saying, look, we know what things are recommended, what actions are recommended by the Maine and the US CDC. They include, when you're indoors in a public space, make sure there's ventilation. They include masking when you're indoors in a public space or even outdoors in a crowded space. They include sanitizing spaces still, using bleach and water to clean spaces which may have been used by folks who are transmitting the virus. So there are a lot of physical things we can do, we should be doing. Mandating washing your hands is not something I'm about to do. But we all know that washing your hands for 20 seconds regularly is something that will prevent the spread of the virus or minimize the spread of a virus. So, we're making every recommendation we can, and people have to take it upon themselves to do the common sense things that will keep them safe, keep them out of the ICU, keep a ventilator out of their throats, and keep their families safe this holiday season and beyond.
And I just might add that, what is different now versus then is the vaccine. When we had the state of civil emergency, when we implemented these population-wide protocols, it was because there was no population or no individualized vaccine, there were no therapeutics, there was little understanding of how COVID-19 spread. Now we do know what works. We do know that the vaccine will prevent serious illness and help avert needless deaths. We also are beginning to see new information that the existing vaccines may be seriously effective against the Omicron variant. So there's a huge difference between then and now, and that huge difference is the vaccine. As Dr. Shah just said, our data show it. The people in the hospitals, the people in critical care are largely unvaccinated. So the best way, the most important way we can help our health systems, our healthcare providers, our EMS providers, our rural healthcare providers is for Maine people to get vaccinated.
I think,
Thank you. Thanks, Kevin.
Go ahead. I think Dr.
I'm
Fauci,
sorry, Governor, please.
No, just to add to that, I think Dr. Fauci mentioned just a few weeks ago, and I know you've mentioned this too, Dr. Shah, that a person who's unvaccinated is at risk, is at something like 14 times greater risk of dying with COVID-19 than those who are vaccinated. 14 times greater risk. That's a chance nobody should want to take.
Yep. Thanks, Governor. We go over to Brian at WAGM.
Good afternoon, Dr. Shah. I got two quick questions. So the first question is, we've heard reports of people purposely getting infected at COVID parties in order to build up an immunity to the virus. What is the CDC's position on this trend of intentional exposure?
First of all, Brian, I'm not aware of those reports in Maine. Second of all, our position is that is a bad idea.
That's exactly what I thought, Doctor. My last question, there have also been reports of children developing a heart condition known as myocarditis following both infections of COVID-19 as well as vaccinations. Is this something that the public should be concerned about?
There have been such reports, and they've been investigated by the U.S. CDC as well as health officials across the globe. The Pfizer vaccine in particular, particularly in younger men, has on occasion caused cases of myocarditis. But as you know, Brian, myocarditis has also occurred after COVID itself. So that raises the question, what's the bigger risk? Getting a very small risk of myocarditis after a vaccine, or a somewhat sizable chance of getting myocarditis if you got COVID? And the US CDC, as well as a number of academic researchers, have run those numbers and have found almost universally that your risk of myocarditis is much higher if you take your chances with the virus itself rather than the vaccine. All the more reason to make sure you go out and get vaccinated.
Thank you, Doctor.
Yep. Thanks, Brian. Joe, let me turn over to you.
Hello. Yes, Governor Mills. So I know there's been a lot of discussion about restrictions, and I know you just answered this question, but I wanted to kind of put a finer point on it. What about restrictions specifically related to people who have gotten vaccinated versus people who are unvaccinated? Like, for instance, you can't go to, if you are in New York City, there's very few places indoors that you can go into without showing your vaccination card. Seems like those two things might work together a bit. What do you think about that idea?
That's not something we're contemplating at this time. New York City is a different environment, a different population, different environment than ours. But I think that private businesses, private sector are at liberty to impose whatever restrictions they wish on who comes into their business. If it's a public-facing business, they're at liberty to do that. I'm not about to impose a restriction of that sort.
Okay, and then my next question is about the National Guard deployment. I'm trying to get a sense of how, like, to what scale, to what scope this helps the hospitals who have really painted a very dire picture today. Does this really make a big dent in improving their capacity, or is it more on the margins? How would you characterize it?
Well, I think, go ahead, Jean. Jean has been talking to the hospitals, I don't know how many times a week, but she's very much up to speed on this. Go ahead, please.
Sure. And it really is this alleviation of pressure that will be provided by the deployment of the National Guard. Our clinicians in our hospitals who are dealing with not just COVID-19 critical care, but other types of conditions, heart disease, cancer, accidents, all those stressors in the hospitals really put strain on the high-end staff. Those high-end staff, though, often find themselves doing other tasks when they're in the patient's room or trying to make sure that the patient gets all of the types of services that he or she needs. So being able to move some of those patients with a less intense need to a different site where they will get good care, clinically supervised. We're not talking about moving people to auditoriums or gyms. We are moving people to either nursing facilities or swing bed units in healthcare facilities will take, we think, a significant amount of pressure off of those critical care and inpatient beds, allow hospitals to move around their staff to appropriately, care for those people in need of severe health. So you can ask the different hospital leaders what they think about this. And we really are focusing on critical care in our largest hospitals, but at least the conversations that we've had with them have shown that this will help. Will it be a silver bullet? No, there's no such thing as a silver bullet. This will help and builds upon the activities that Governor Mills outlined that we've already done, and we'll continue to monitor to see what other types of activities we will do in the future, because our work is not done. Our work is not done until we really have fully stabilized our healthcare system across the board.
Just real quick, is there a way to put a number on it at all? Does it free up, say, 10 to 20% or 30% of space capacity for COVID patients?
Yeah, it's not easy to put a number because, depending on the type of care, there's different staffing ratios. So there may need to be more National Guards people supporting somebody at a higher level of care than a lower level of care. So there's no magical number. But, doing a deployment of up to 75 members of the National Guard will certainly free up dozens of beds in our hospitals.
Thanks, Joe. Caitlin, over to you.
That's the one and only. Good afternoon, Dr. Shah, Governor Mills, and Commissioner Lambrou. My first question is, with things as kind of challenging as they are in Maine's hospitals right now, has the state thought about activating its crisis standards of care plan?
I'll begin by saying not at this point. That is a last resort. We are not yet at last resort. We continue to try to support the provision of critical care, hospital care, and emergency care. We hope we never get there.
I guess following up on that, Commissioner Lambrou, I guess why not, I guess at this point, what would we have to see in order to feel like that's the appropriate step?
So I think there's some sort of magical threshold that we'll cross and we'll say now is the time. We obviously closely follow the circumstances on the ground in our different communities, but I'll flip it around. Our job is to provide quality healthcare to all Maine residents, and we'll move heaven and earth to try to make sure that we can continue to do that. We talked previously about the federal resource request for clinicians. We'll continue to push on that. Governor Mills has been relentless in talking to the White House COVID response team and others to make sure that we are well-resourced whenever possible, and we'll continue to do that. We appreciate the National Guard's willingness to come in and help us in this critical mission. That will make a difference at this critical time. So we will exhaust all remedies to make sure that people get the high-quality health care that they deserve.
Okay, and my second question is, I know hospitals in some other states have been considering sort of offering legal protection for hospitals during this time, if they're trying to provide care during a crisis to ensure that they have liability as they're just really stretched thin right now. Is that something that the state of Maine has considered?
We have a pretty sophisticated medical malpractice system, and that's not something that's been asked for or that we're offering.
Thank you.
Thanks, Caitlin. Rebecca from the Ellsworth American, over to you.
Hi, thank you, Dr. Shah and Governor Mills and Commissioner Lambrou. I have two questions. The first is, how will it be determined where these National Guard members go? How will communities know whether to expect them or not?
So we are, in a high stage of planning right now to ensure that we are best maximizing the use of our members of the National Guard with facilities that are ready to train them, ready to make sure that they have the support that they need to be helpful in these situations. So we don't at this moment have specific facilities and sites and numbers, but we're clearly working on a plan. And as Governor Mills said, our upper bound here is we're hoping for up to 75 people that we could deploy as soon as next week.
Thank you. And my second question is, I read this report in NPR. I think it came out at the end of October, and one doctor from Stanford University was quoted saying that it's getting sort of inevitable that people will get COVID-19. It just is a matter of whether they're vaccinated or not. Is that a valid statement at this point?
I can start, Rebecca, or Governor, please.
No, please.
I've heard that sentiment expressed. It strikes me as a bit more fatalistic and nihilist than I like to be. But let's not underestimate the risk. The virus is circulating at levels that we haven't seen before in the pandemic, and that doesn't even account yet for the Omicron virus or variant rather. And so I don't want to I don't want to downplay the risk, but it need not. We need not contemplate the world in that manner. You don't need to think about it as I'm either going to get COVID through the virus or get protection by the vaccine. The vaccine is not something to fear, right? The vaccine has been given now to hundreds of millions of people, billions around the globe, and has safely offered them protection. But if you're not getting the vaccine, then yes, your risk of getting COVID and suffering severe complications is significantly higher. That's not a risk anyone should have to take right now.
Thank you.
Thanks. Let me go over to Brian Sullivan next.
Thank you, Dr. Shah. This first one's for you, and Robert has actually answered this for me in the past, but I think maybe the people at home would like to hear it from you. Why does the number you give us on the amount of people fully vaccinated during the briefing not reflect the same number that is on the CDC website?
Got it. I'll be brief here, but the bottom line there is that the numbers that are reported to us are reported to us by folks who on the ground get their vaccine directly from the state of Maine. That includes most healthcare providers, most pharmacies, most teams out there doing vaccines. But there are other groups that get their vaccine directly from the federal government. This includes, for example, tribal clinics that are operated by the Department of Defense, clinics that are operated directly by the federal government for federal employees. Because they get their vaccine directly from the federal supply, they don't have an obligation to report into us, but only to the US CDC, and that accounts for the difference.
Thank you very much. Now, this is for whoever wants to take it, but and I know we don't like to look in our crystal balls, but you mentioned off the top that the expectation is that cases will stay around this level or go up in the near future. And here we are 13 days removed from Thanksgiving, and we've activated the National Guard. What is the anticipation for, I guess, the landscape for the state with another big holiday looming and the National Guard, I guess at this point, being in the state's use until the end of January? So just an idea of what perhaps lies ahead.
I can start that just from the epidemiology side, and then for the response, I'll pass it to the governor and the commissioner. But Brian, I want to either correct or revise or amplify what I said earlier. Cases for the next at least incubation period will stay at this level and also at least rise in the near term, just based on the patterns we're seeing and the trajectory that we have been on. Some of this is a function of likely transmission that occurred in and around the Thanksgiving holiday. But it's important to note that the increase we're seeing preceded that holiday. It was likely amplified by the gatherings that occurred around Thanksgiving, something we saw last year. It's something we predicted would happen this year. That is likely to continue. That trajectory of more cases being logged every single day will continue for the foreseeable future. What that means from the response perspective, I'll turn it over to the governor and commissioner.
Yeah, no, I mean, I'm not the epidemiologist and I can't predict where this is going, but I think we are going to take it day to day, week to week, do everything we can, everything in our power, and asking for help from the federal government. First and foremost, getting those FEMA applications allowed. If that happens, it'll be a big help. But, with cold weather setting in, people are naturally going indoors more, and people want to get out. People want to go to concerts and restaurants and places where they can see friends and hang out. That's a natural thing. But, where this trajectory goes depends in good part on the precautions that you all take and the number of people getting vaccinated. There's still too many people who haven't even got their first shot. And it's not fair to the rest of the population who've gotten fully vaccinated, who've done their part, and who don't want to be deprived of the ability to get a hip replacement or some other surgery or healthcare access. It's not fair to them. It's not fair to anybody. So if everybody does their part, we're going to level this thing off and address it as a team. That's all hands on deck right now.
Thank you.
We go next to Hannah at News Center.
Hi there. Just going off of Brian's question, how concerned are we now that we are, for lack of better words, being pushed to the edge that the Christmas holiday, travel, even potentially larger gatherings than Thanksgiving will push Maine and our hospitals over the edge?
I'll start. It's definitely a risk. We're concerned. That's why we're taking the actions that we're taking today that the governor announced. It raises the right question, though, Hannah. What does this mean for your family's Christmas gatherings? And as I've told folks, as told our team, this just underscores the importance of making sure that every single person at your December gatherings is fully vaccinated. And by every single person, we mean every single person. And by fully vaccinated, we mean fully vaccinated. We're still a ways out from when a lot of those gatherings start happening. You've got time, if you have just gotten your first shot, to get your second shot. I think it's now time to make sure everyone is getting a booster as well. And you've got time, if you're looking to get a booster before those gatherings start, you've got time right now to make that happen and not just be fully vaccinated, but fully boosted before that.
Thank you, Dr. Shah. And then just lastly, you mentioned 7 kids hospitalized right now. What are their ages?
We can get you those age ranges, Hannah. They are all minors. They're all under 18, and we can get you the ages.
Thank you.
Mm-hmm. Thank you. Let me go over to Amy Brown next.
Thank you, Dr. Shah, Governor Mills, and Commissioner Lambrou. I apologize if this was addressed already, but yesterday the CDC website said that there were 26 ICU beds remaining. Today it says there are more people in the ICU, but there are 42 beds remaining available. And I'm just wondering if that hasn't already been addressed, if you can explain what happened there.
Sure, Amy. The thing to keep in mind with that number is that it denotes staffed ICU beds, and staffing patterns at different institutions across the state vary day by day based on who's in for work, who's not in for work, things of that nature. So the key variable, the two variables driving that are how many patients are in need of a bed. And as you've seen, as the number of ICU patients has risen, the number of beds has fallen. But some degree of the day-to-day variation is driven by how many staff are available. And by staff, we mean not just nurses, but respiratory therapists, environmental staff, food service staff, patient transport, all the people that are needed to make an ICU bed an ICU bed.
Okay. And has any consideration been given to setting up a booster clinic in the Bangor area to take some pressure off some of the pharmacies in this area that are saying that they're overwhelmed?
Yep, I can start there too. All of these sites, all of these areas are under discussion. We started with Augusta for a number of reasons. One is that it was a location that we could act on very quickly in partnership with the Maine Emergency Management Agency and the Maine National Guard, being that we're at the Armory. The second is that as we looked at where there was the highest need based on complaints and concerns that were voiced to us, we saw the bulk of those from points north of Lewiston down to the mid-coast, and then from the the Waterville area, slightly east and north of there, down to Augusta. And that's where we started. That's not to minimize the challenges that others have faced in the southern parts of the state or up in the Bangor area. But that's why we started in Augusta, because we wanted to make sure that this being an area where there are not many alternatives, we started here.
Okay. Thank you.
Thanks, Amy. Dustin, over to you.
Thanks, Dr. Shah. I'm not sure who this question is for, but perhaps it's for the governor. What was the true deciding point that the National Guard should be activated? Was it the ICU capacity at Maine Med on Monday? Was it the record numbers of overall hospitalizations and cases? Was it the number of children in the ICU, or was it kind of all this together?
Well, I guess thank you. All of this together. The fact that it was not leveling off, not going down, but actually going up. We watch these numbers day to day, week to week, and the expectation was at some point within recent weeks that would have leveled off. And because it's not, because more unvaccinated people are ending up in the ICUs and on ventilators, the numbers have not leveled off. They have not gone down. They're just going up.
And then initially there was some concern that by activating the National Guard, you're pulling some of those folks out of other healthcare jobs. What's changed there?
Yeah, no, thanks. That's a good question. And we're not taking healthcare professionals out of healthcare settings to put them in another healthcare setting. That's not what we're doing. These are non-healthcare trained, primarily non-healthcare trained National Guard folks who will be doing not healthcare jobs, but support work and monitoring the monoclonal antibody treatments and things of that sort, where you don't have to be a licensed nurse, CNA, certified CNA, or a physician to do those things.
And again, this one, go ahead, Governor.
It's the domino effect. The more people in the ICU, the more people taking on med-surg beds. And when they get better, there's no place for them to go. When they still need help, they still need health care. So we're alleviating the backlog on the hospitals by filling in at the back end there, front end and back end.
And then this one might be for Dr. Shah. What does the number of children in the hospital and in intensive care with COVID tell us about where we are in the pandemic right now?
Yeah, Dustin, it's another dark day. Unfortunately, those numbers of children as well as children in the ICU are themselves both high points for children hospitalized throughout the pandemic. Early on in the pandemic, there was this notion that children were spared. But as we've seen with the Delta variant and its higher transmissibility, that is not the case. And there's been this curious phenomenon that I've observed with people continuing to believe that children are not affected by COVID. That is absolutely not the case. And even more curious observation are folks who say that COVID is not that bad for kids or in kids. And I hope today's numbers of children hospitalized and in a pediatric intensive care unit bed put that notion that COVID isn't that bad for kids completely to rest. It's all the more reason why kids 5 and over should absolutely be vaccinated.
Thanks.
Yep. Let me go over to Sean Murphy from Spectrum.
Dr. Commissioner, Governor, thanks for the time today. Just wanted to follow up on the question about the Augusta Armory Clinic, and you had mentioned that you're examining the whole state. Can you speak a little bit more to whether or not you definitely plan to open similar clinics elsewhere in the state?
Sean, not at this time. The principal focus is on the area in and around Augusta, given what we saw from reports and the lack of availability of alternatives in that area. We are continuing to monitor for reports, but what we've seen is that in the southern Maine area, the large-scale site that operates in the Sanford area by York County EMA is continuing to do 6 or 7, 800 shots per session. Similarly, the Auburn Mall continues to be active in providing an option for folks in that part of Maine. We wanted to fill a gap that we saw right here. The other thing that's changed is that in previous times when we stood up these sites, they were done largely in conjunction with or by hospitals. But we've already heard the challenges that hospitals are facing. So we're monitoring the situation in other parts of the state, but I don't want to overpromise and suggest that more are coming This site was one we stood up very quickly because of the partnership we have and the availability of a location. We'll continue to monitor. No question about that, but this is our primary focus at this time.
Thank you, Doctor. Just one other question. I was wondering if you could speak a little bit to the relationship that perhaps Maine has with some of our neighboring states. Just pointing out that New Hampshire today is reporting some record-breaking numbers as well. I think their hospitalization numbers are in the 400s. Do you collaborate with your counterparts in other states on this in any kind of regional fashion? And if not, have you considered doing so?
I'll answer just for myself. The answer is yes, quite extensively. My counterpart in New Hampshire and Vermont, to say nothing of Massachusetts, Connecticut, Rhode Island, we're on the phone quite often as a group of public health practitioners to talk about trends that we're seeing, et cetera. Sean, I want to pass it over to my colleagues, but since you mentioned the Augusta Armory, I failed to mention the numbers as of this morning, which I'm really proud of. As of the beginning of the briefing, we were at 524 shots given today, 14 of which were among children. So I just wanted to get that number out there. The site's open, please come. But as to your collaboration question, my counterparts and I certainly do. I'll turn to Governor and Commissioner as well.
Yeah, I mean, we're on weekly calls with other governors across the country and with the White House talking about regional and national problems and issues that the White House has very much helped us resolve. But we'll obviously rely on the public to share and address public health needs and epidemiological trends and advise us on those.
Let me go over to Megan at WMTW next.
Thank you to all of you for taking our questions today. I think this has sort of been touched on earlier in our discussion, but I just wanted to be clear that, earlier in the pandemic, we talked about, or at least when we entered into it, we talked about having those sort of triage sites in large scale venues in order to alleviate any kind of stress on the hospitals. It sounds like that's really not part of this strategy right now, but is that possibly a part of like a phase 2 if the numbers are just not going down?
You're talking about alternative care sites, like at an army.
Yeah, exactly, Governor. Like when we talked about the expo or something like that. Is that part of it? Yeah.
Yeah, no, we did talk about that a year and a half ago, and we were prepared to do something like that if the need, if it rose to that level. But the staffing is the issue there, I think, primarily. And there are facilities available that are connected with hospitals where there's good alliance with hospitals, which are, I think, more amenable to healthcare, basic healthcare, and with the National Guard helping out, and hopefully with the FEMA medical teams, we'll be able to backfill the needs of the hospitals and not rely on, some big civic center kind of place for monitoring healthcare needs of people.
Okay, thank you. And then my last question is, as we've talked about strategy a number of times throughout these briefings, the strategy really is, we have something we can do. We can all get the vaccine, but kind of who isn't really getting the vaccine is seeming more like the issue really than the strategy, right? I mean, if everybody got it, we'd probably be in a different place. So anyway, do we continue to encourage the vaccine to people who haven't gotten it? Or yes, but is there something else, some other strategy to try and bring these numbers down?
The vaccines it's what we were praying for, begging for, hoping for a year ago now, and on the verge of getting a year ago this week. And it was so exciting to see that come down the pike. August, September, October of last year, there was an air of desperation among many communities in Maine. We were very concerned about the holiday season. We didn't have a vaccine. Now we have 3 vaccines. And people were so excited when we started the vaccine clinics and when Northern Light and Maine Health had their mass vaccination clinics, and it was extraordinarily exciting. And now the figures show that something like 98% of people over 65 or a certain age group are fully vaccinated, and a large number of people under that age are vaccinated. But there's still, nationwide, there's that gap of people who, for whatever reason, are not vaccinated. And there's been hesitancy still. And what we're seeing, as has been reported in these news conferences before, is particularly a low vaccination rate in the rural counties of Maine. And, when I walk around my town and go see people, there's a sense of, well, there's still a bit of a sense of it can't happen here. But it can happen here, and it is happening here. I think 45 people died just in Western Maine in one 60-day period recently. 45 people in the 2 or 3 small hospitals in Western Maine. That's a lot of people, a lot of our friends and neighbors who died with COVID, most of whom were not vaccinated. So I guess getting the message out there is a big part of what we have to do. And the media are certainly helpful in that respect. And thank you for that.
Thanks, Megan. I'm going to go to Dan at the Maine Beacon next.
Thank you. 2 quick questions. First for Governor Mills. Other states, including Colorado and Missouri, have delivered free rapid tests to people's homes. And is Maine considering doing anything like that to support testing as a way of allowing people to isolate early to slow the spread of the virus?
I'm not sure what Missouri and Colorado are doing in that regard. That may well be in the cities where it's easy to get to people's homes, but whether or not this is just for people who have symptoms of COVID, I'm not sure what the circumstances are.
Or anybody that requests it, yeah.
Well, we're making sure that tests are readily available. There are now 3 different kinds of tests, I think, and 13 actually producers. And we're on the White House calls every week about pumping out more testing supplies to the pharmacies and to the states of Maine, and doing our pool testing. I think it's about 40% of the schools right now have pool testing, which is helping keep kids in school. So home delivery. It's not like delivering pizza. I don't know. If there are people who have a mobility issue, a challenge, we're happy to help in that regard. And I'm sure the CAP agencies will help in that regard, or get them to vaccine clinics where they can get vaccinated if they haven't already been vaccinated.
And a question to Dr. Shah. You mentioned at the top just a new threshold or high mark in terms of the PCR testing today. Are you considering any efforts to increase the ease and availability of PCR testing?
Well, Dan, first, it was not the absolute high mark. It was one of the top 3 or 4 peaks that we've seen in our PCR testing volume. And that's a good sign. It means that testing is being done across the state, and that increases our visibility into how the pandemic is unfolding and how the virus is spreading. So those are all good things. Making testing more available has always been one of our principal goals. So we're not slowing down those efforts. We're not reaching a high mark of 700 plus PCR tests per 100,000 per day and then picking up and going out. We're going to keep trying to make testing available at that level.
Okay, thank you.
Thank you. Let me go to Emily Bader from the Sun Journal for the final question today.
Hi, good afternoon, everyone. My first question, I'm wondering, in terms of the Federal Surge Response Team for Maine Med and Central Maine Medical Center, how were those 2 hospitals chosen to at least get the first group of response teams?
So let me actually clarify. They chose us, not us choosing them. So hospitals across the state, across the nation can apply for this assistance with state support. So they do a lot of the work in filling out the application, demonstrating need, showing that they've done due diligence to try to exhaust all other options to get staff. The state of Maine, through our emergency management agency, as well as Department of Health and Human Services and CDC, provides assistance in filling out those applications, verifying information. So these 2 hospitals did complete their applications preliminarily. They have been submitted. We're working with other hospitals as well who are interested in doing it. We are hoping for federal approval of those applications.
Okay, thank you. And my second question, I believe this has been asked before, but I'll go ahead and ask it again. Are there any efforts or reasons to disclose, when we get daily updates on who have passed away from COVID, the vaccination status of those people, and in addition to that, more regular, like hard numbers on vaccinated versus unvaccinated people in the hospitals?
Sure. I'm just going to say that the Maine CDC website does every week on Fridays post exactly those data on the number of cases who are breakthrough cases, the number of hospitalizations that are breakthrough cases, and the number of deaths. Oftentimes in real time, we don't have that information. So that's why it's done once a week with some review. But Director Shah, if I missed anything, you just let me know.
That's exactly right, Emily. Commissioner and Emily, there's, so nothing further to add. Nothing further to add.
I'm sorry, go ahead.
No, back to you.
Just a very quick follow-up. What about disclosing vaccination status by age?
Vaccination
in terms
status
of deaths, in terms of not just breakthrough infections, but breakthrough infections by age.
Oh, stratifying the breakdown of breakthrough infections every week. It's Emily, I can't promise that we'll do that. Here's the thing. Every single data request involves a team of people to pull the request, another team to validate it, and a third team to ensure its statistical accuracy. And we have tough choices to make in terms of what data that we find to be actionable from a policy perspective or instructive to help us understand how the pandemic is unfolding. If we had our druthers, we'd have a massive team of epidemiologists, mathematicians, statisticians, informaticians to pull all of those. We don't have that. No state does right now. So we've unfortunately got really tough choices to make.
Okay, thank you, everyone.
Thanks. And Emily's question was the last one, Governor. So I will turn things back over to you.
Hey, thank you very much, and thank you to our colleagues in the media. And I just want to give a big thanks to the thousands and thousands of doctors, physicians assistants, nurses, RNs, LPNs, and CNAs, and other medical healthcare workers across the state who are working so hard and keeping people as safe as they can, as healthy as they can. And I hope you all think about them and about their holidays in the coming weeks. When I hear people say COVID's not a problem, I heard somebody had it and it was just like the flu. It was no worse than the flu. That's not what the healthcare workers are saying. And that's not what the 379 people who are hospitalized today are saying. It's not just like the flu. And if you're one of those 60 people on a ventilator, it's not just like the flu. And when people say, I don't want to wear a mask because I don't want to live in fear, which some people have said, it's not living in fear. It's living with common sense and living in a way that cares about the health and safety of other people in our society, including other people you meet in public, indoor and outdoor activities. I'm hearing a lot from people who have been vaccinated, fully vaccinated, and now who are not able to access other kinds of health care because of the crowding in the healthcare facilities. Let's think about them too over the next few weeks in the holiday season. And some who won't go into public venues, won't go shopping at the local stores, but will go online instead, won't go to local businesses because they don't want to go to places where people aren't abiding by common sense rules and protocols, not wearing masks, etc. But mostly, think about our healthcare workers in the coming weeks and months. Let's do everything we can to take the burden off of them and keep people safe. Thank you very much.
Thank you, Governor. Thank you, everyone. Have a good afternoon.